funny thing about me, I have sort of developed this bad habit of ending up in the ER like every 9 months on like a pretty regular schedule because I'm both incredibly clumsy and a little too cocky, I think. And I can confirm for you from this interaction with this tiny sliver of the healthcare system that it's incredibly broken, it's inhuman, it's astronomically expensive. I can't really imagine what it's like for someone who actually has to interact with the healthcare system on a real basis that isn't just getting stitches or an x-ray. So that's why I want to introduce Leslie, who's our next speaker. Leslie Ziegler is the chief evangelist at Rock Health, and she's going to talk about how they design and incubate new solutions to make our healthcare system a little more human-friendly.
This, right? Hi guys, hope you're having a good day so far. So I'm Leslie, I am the chief evangelist at Rock Health, and I wanted to start with this quote because I think it does a pretty good job without me having to actually talk about it of encapsulating the culture and the dynamics that we encourage in our community. This actually was written by one of our advisors in email format. So really what I'm going to be talking about is the convergence of Silicon Valley and healthcare. So Morgan already alluded to it. We feel like the healthcare system has some work to do. And just to actually put some numbers to that, healthcare spending, we're in an election year. Nobody needs a lot of reminders about where we are with that. But just for context, this is what's happened in the last 40 or so years. So we started out at 85 billion. We've far more than doubled that in 2010, and if we stay our current course, we're going to double it again by 2020. So clearly this is a problem that not only as a patient really affects all of us, but also as taxpayers. And this is just in the US. The same thing's happening globally in different ways, but clearly there's a problem. So just to put, as if trillions wasn't enough, it's actually going to be over 20% of our GDP, and it used to be about 5. A lot of money. A lot of business opportunities. So who drives this? Who's driving the change in healthcare, and who's driving kind of what's happening there? So traditionally, it's government, it's large institutions, it's hospitals. But more and more, what we're seeing is developers and designers and really impactful and passionate individuals who are creating companies in this space and starting to drive major change. And it's tough. It's not easy as a company of 2 or 3 to work with these institutions. And many of the people that we incubate and that we work with are actually not from healthcare backgrounds, which is something that's really exciting for us. So we really embrace this idea of diverse minds, which means you're a designer at IDEO, Google, somewhere totally unrelated, and you want to bring your superpowers to the healthcare system and really work to make things better. And that's kind of where we step in. So, we're talking about this idea of diverse minds. What does that actually mean in practice? Well, I'm actually one of those diverse minds. So I'll start with my story, actually. So this is me. It's about 3 years ago. I'm backpacking in Point Reyes, for any of you who live in San Francisco. And I was perfectly healthy. I had a really great job in advertising. I was a creative type, McCann Erickson and DDB, a couple places, and was very happy in the work that I was doing as a designer and writer. And I didn't have any reason to have an opinion about the healthcare system because I was healthy. No broken bones, no cavities. So things were going well, and then life changed. So I'm sorry it's right after lunch. I apologize. But this is an actual image from my very first colonoscopy. So I went in and I was diagnosed about 3 years ago with ulcerative colitis, which it's a gastrointestinal issue. It causes this lovely thing right here. It's an ulcer. I was told 3 years ago that my life had to fundamentally change, which was a tough thing to hear. I'm a huge foodie. Anyone who knows me knows that I love food and wine. And it really changed the way that I live my life. But what I think was equally as offensive to me, especially as a designer, were the litany of problems that I saw in the healthcare system. It didn't matter what I was doing, what test I was taking. There are so many issues and places for improvement. So one we can all relate to, the hospital gown. Like, my God, why has no one redesigned this yet? It actually has not seen a redesign since the 1920s, no joke. How has something like this existed for almost 100 years with no one making a meaningful difference there? So, Diane von Furstenberg did an exercise with the Cleveland Clinic. They have cool-looking wrap dress hospital gowns, but the rest of us are still stuck with this. Readmission instructions and follow-up instructions when you have a medical procedure are on pieces of paper. We still live in a place where our healthcare system is largely run on pieces of paper, binders, and clipboards. And I don't know about you, but I'm kind of a digital junkie. When someone hands me a piece of paper, the first thing I do is immediately lose it. So I would much rather get these things in email format. But it's a big problem. There's a lot of legislation right now that's around meaningful use and getting all of these records digitized, but we're still not there yet. Paper is still the way things are. The crowd's a little young to have actually had to go through what I went through, but colonoscopy prep is actually the #1 reason that people don't get check-ins. So you're supposed to have a screening like once every 5-10 years when you reach age 50. #1 reason is because the prep process sucks. It's a day of not eating, and then you have to drink this twice. And it's disgusting. It tastes like rancid lemonade. It is not a pleasant experience. But the really crazy thing is this is actually costing people lives. 50% of colon cancer-related deaths could be prevented with simple screenings, and this is the #1 reason that people aren't going. Being the designer creative type I am, I'm thinking we have Top Chef, we have Extreme Home Makeover, why don't we have something like this for medical prep, where is the Jamie Oliver in this situation to really, start making something? I would totally drink dulce de leche flavored, medical prep. It wouldn't be nearly as painful. But the reality is we haven't made it there yet. And so, that's why I'm really excited to be part of the founding team at Rock Health. And I'll bet you're all wondering what it is we do. So, Rock Health is a digital health nonprofit that sits at the intersection of healthcare and technology. So we do large events like this, small public events that are designed to bring people together. We do research into different topics, into digital health, personalized medicine, sports, all kinds of interesting things that we find intriguing. And the thing that most people know us for is actually the incubator that we run. So we run a 5-month program for digital health startups who are just getting started. And I'll talk a little bit about the teams that we support in a second. But it's a really great program, and we are fortunate enough to work with some of the best hospitals, venture capital partners, and corporations in the world. We work very closely with the Mayo Clinic, investors like Kleiner Perkins, and organizations like GE and Nike that help our startups really understand what they need to build a successful product and to make an impactful business. And it's working. So we give each of our startups $100,000. We incubate them for 5 months. We have shared office space, lots of mentorship, all kinds of operational support. And at the end of that, we conclude with a demo day where they show off all the great work that they've done. So let's talk a little bit, since we're all designers in this room, what is it that it takes? And it's not exclusive to healthcare, but I think healthcare, it's especially pertinent that we have people who can make stuff. So when we look for teams, it's typically very small when they come to us. It's a seed stage. So it's a team of 2 or 3, primarily, and we look for a maker, and we look for someone who can sell. So the maker is a designer, a coder, someone who can actually fulfill a product, and then we look for a salesperson or someone who can actually go out there and sell, commune with customers, kind of understand what they need. So it's a really great thing. We've seen lots of designer founders. We're seeing more and more, which is really great, because I think we've seen that there are a lot of perceived barriers to entering the healthcare system. A lot of people think it's hard, and it is. There are a lot of regulatory challenges, whether you're here in the US or you're global. And really what we've done is try to bring down the challenge there so that they can get what they need, move quickly, be nimble, all of that good stuff. And I'll also say that as you're thinking about, if any of you are considering being entrepreneurs, really the team is what we look for. It takes a lot of persistence, and there are a lot of tears involved with starting a company. It can be hard going, but really having a phenomenal team with this kind of skill set is a great start. So these are a couple of the places, when I talk about the whole diverse minds idea, these are just a few of the places that our entrepreneurs have joined us from. Traditional tech backgrounds, IDEO, med school dropouts, all kinds of people. And it's really phenomenal to get them all in the same place. We have shared office space and see what happens. There are a lot of really interesting things that just happen on a day-to-day basis outside of the scope of just them building their products. So, these are a couple of the places, when I talk about the whole diverse minds idea, these are just a few of the places that our entrepreneurs have joined us from. Traditional tech backgrounds, IDEO, med school dropouts, all kinds of people. And it's really phenomenal to get them all in the same place. We have shared office space and see what happens. There are a lot of really interesting things that just happen on a day-to-day basis outside of the scope of just them building their products. what does this actually look like? So you guys all know, you're all mostly designers. What does that process look like to start a company or build something meaningful in healthcare? Well, it's a process all of us know really well. You build, you measure, and you validate, you learn, and you do it again, and you do it again, and you do it again. If any of you are interested in learning more kind of about the process that's right here, one of our mentors is a guy named Eric Ries. He coined the term lean startup methodology, and he's written a great book about it that goes into this at greater depth. But really, this is the kind of tactical process that our startups go through month after month as they're with us. But I wanted to take a second and actually talk about why I think designers are so critical to healthcare. So, when we're talking about people who are dealing with problems, whether you're a caregiver, whether you're a patient, you're really at your most emotionally and physically vulnerable. I mean, odds are there is something physically wrong, but then the psychological ramifications of dealing with that are quite difficult. And I think that this is just where designers can make a huge impact. We have an ability to empathize with the people that we do work for. We have the unique power to really understand their needs, understand where they're coming from, and then build things that are surprising and delightful. Because after all, I think everyone in this room can agree, when there's something wrong, even small things matter. And small things make a big difference in the recovery process as well. Things as small as painting a room in a hospital can actually increase positive outcomes. So people get well faster when there's color, when there's something bright, when there's something cheerful. So improving outcomes is just one kind of small thing that it does. But when you're in that situation, it really matters. Quick synopsis of what we've been able to do in the last 2 years. We haven't even been around a full 2 years. We've done a lot of these reports, we've done a ton of events, and we've incubated 35 startups. We're actually selecting our 4th class right now, who have raised over $25 million in follow-on funding from great investors like Vinod Khosla, NEA, lots of really top-notch people in the space. And we did this all with 6 employees, which actually 6 months ago we only had 3. So we're also a very small, lean, scrappy organization, and we make a lot with very little, which is actually nice for our startups as well. We try to operate kind of the same way. So speaking of our startups, I want to go back to kind of where these guys come from and what they're working on. So first one, it's called Nefosity. The founder was actually working at DreamWorks Animation in the rendering side of things. So he was rendering things on the fly for animators and then delivering them back. Well, his brother worked at the Brigham in Boston as a radiologist and said, hey man, can you do the same thing for medical images for me? And that's how Nefosity was born. So they started the company. It's a collaboration tool that lives on the iPad that allows doctors, remotely or even just within the same hospital to leave notes for each other on medical images or collaborate from afar. So it's really neat. But again, medical side of the house meets animator equals something really cool that's making a big difference in hospitals. The next one, so Omada Health is a really great one. They came up to us out of IDEO. One of them is a med school dropout, Harvard med school dropout. Another one was the head of IDEO's health practice. And the other one is just a killer hacker. And they took this curriculum called the DPP, the Diabetes Prevention Plan. It's an intervention that if you basically follow it right before you get diabetes, it will stave it off. So those who have pre-diabetes follow these 16 simple steps on a piece of paper, by the way, which is how it was delivered, and you will not actually progress on to full-blown. So it's about $10,000 a year in savings to the healthcare system for everyone that completes this. And they do it through this really great social platform and a wireless scale where they're actually able to track people remotely, have these cohorts that connect to each other. The outcomes have been great. And what's even crazier is when the program actually ended, in their first pilots, everyone said, hey, can you just maybe leave it on for us? We really don't want to give this up. So really changing the way people get better, heal, and prevent disease. CellScope is a really neat one. So it's a clip-on attachment that fits on your smartphone that turns it into an otoscope, which is something you use to diagnose ear infections. And if there are any parents in the audience, I'm sure you can all relate. A lot of ear infections happen years 1 through 3 for children, and this actually saves a ton of time. So you take a picture with your smartphone, it transmits to a doctor. The doctor says ear infection, not ear infection, writes the prescription if it is one, and then you skip the visit altogether. So it's a really neat thing. The crazy thing, right? I'll tell Amy you guys liked it. But I think the potential it has to save parents in this country time is phenomenal, but also the impact that it could have globally in developing countries where the cost of medical products are just so high and so out of reach for so many people. Doctors, not enough doctors can be in those areas. They're building out actually a whole suite of these products to treat the throat, the ear, skin, everything. So it's really nice, and they came to us from Berkeley. So they were in a lab in Berkeley before they came, and now they're in an office in San Francisco hanging out with Vinod Khosla, who is their investor and the founder of Sun Microsystems. Pipette is a neat one. So remember those readmission instructions that I showed you earlier, the paper ones? They're actually working to fix that. So what Pipette does is has a number of trackers that go home with you. You commune with your doctor via the wireless, any wireless device, and actually can follow your readmission instructions and recovery instructions through a digital platform. It allows the doctor to know if you're not being compliant, and it allows you to not have to keep track of pieces of paper. So the founders of this company, it's actually pretty neat, were a designer and a developer at Microsoft, the Mac side of the house, not the normal side. And really great, really phenomenal designer, really great developer. Their company was actually acquired, and Ryan is now working at the White House as a presidential fellow. So he's hanging out with Todd Park and Obama, doing amazing things within their world now. So I think a lot of the best ideas and a lot of the best solutions actually come from patients. So Sean Ahrens was in our first class at Rock Health, and he is the founder of Healthy Labs. And their first product is something called Chronology, which is trying to build a genome of IBD. So I have ulcerative colitis is IBD. So nobody knows what causes it, and there is no cure, which is a very frustrating thing as a patient. So Sean's created these great communities where people can come, share their treatment solutions, share what they're doing, share their outcomes, keep track of everything, in the hopes that he actually builds this genome that can eventually solve that problem. So really big thinking and really phenomenal developer. And he's actually a bit of a designer too, kind of a unicorn. Okay, now we're going to play Where's Waldo? Find the medical device in this picture. Anybody? It's not the plastic giraffe, believe it or not. Okay, so the medical device is in the rug. So we had a team join us in our Boston program that we had at Harvard Medical School this summer called Podimetrics. And Podimetrics is working to rid the world of diabetic foot ulcers. I spared your eyes what that looks like. Suffice it to say, it is not pleasant. And it causes 92,000 amputations in this country every year. It's a very painful process, and it's very easily solved. So what Podimetrics does is basically you stand on the rug, you would put it in your bathroom, so you're washing your hands and it just kind of happens. The notion of passive tracking and passive monitoring is something that's very important in health. There are, a chunk of people that are early adopters. I have a feeling this room is full of them. And then there's the rest of the world that is not that motivated to keep track of their health care. So what this does is it passively allows you to do what you're doing anyway. Step on the mat. It takes a picture of your feet, transmits it to the cloud. An algorithm runs and tells you, is there an ulcer progressing or is there not? And transmits it back to you via a red or a green light. And if there's a red light, you get a phone call within the next 10 minutes. If it's a green light, you're cool and you can go on with your life. So some really neat things happening at Rock Health. And just to kind of bring things back around, it's easy to see how these could impact lots of people's lives. And I personally, since I came from a non-healthcare background, I strongly believe in the notion of method acting, so actually trying things out. Rock Health actually has become quite a little petri dish of activity in and of itself. We were all, taking blood glucose a couple times a day for one of our teams, and weights and sharing. I've actually open sourced all of my health data to any of our startups that want it, which is a lot of stuff because I've tried over 30 different devices, apps, all kinds of stuff. Have a food diary of everything I've eaten for the 9 months. This is actually me right after doing Wellness FX, which is a really neat blood chemistry tool that allows you to see kind of where your deficiencies are. I was also very afraid of needles before this, so this was kind of my way of powering through that. But these devices and these technologies have made a real impact in my life. In fact, so this has actually just happened a couple weeks ago. Through medication, it's hard to tell how much of it's the medication and how much of it's the technology. I tend to think it's both. But I actually just found out 3 weeks ago that I am in remission. So I have a very, thank you. Yeah, so I still have it. I will always have it. There is no way to know what will make it go away because nobody knows what causes it. But I have a fairly normally functioning system right now, so let's hope it stays that way. But had I known about a lot of this before, I actually got my 23andMe results back, and I am 3 times more likely than the average person to have ulcerative colitis. Had I taken that test 5 years ago, I would have been in a much different place than I am today. So anyway, thank you so much for having me, and if any of you have a digital health idea or just want to talk about the convergence of design in healthcare, please come find me afterwards. Thank you.